when I graduated from medical school, which was not so long ago, in case you're wondering. I was so excited for what's ahead of me. Because after years of hard work and countless sleepless nights, I can finally practice the profession that I love. I can finally help and heal people. I can finally make a difference in their lives. But little did I know that what's ahead of me was being rushed to the ER, clutching my chest, gasping for air, barely breathing. The diagnosis? Severe adult onset asthma. Difficult to control, triggers unknown. Whenever I think about it, it was probably the lowest and the most depressing moment in my life. Because the doctor is now the patient. The supposed to be helper, now feeling helpless. To cheer me up, I can still recall my mom telling me there must be something in the air. To which, of course, being the young and the stubborn doctor that I was, I shrugged off her comment and then I told her, Ma, I'm the doctor here. And that's not how medicine works. But to my surprise, not so long after that, I came across the story of a 9-year-old girl named Ella Kissy Deborah, the first person ever in history whose cause of death was officially pronounced to be air pollution. That story shook me to my very core. Not just because now I had to admit to my mom that she was right all along, which I never did, and I'll never do, by the way, but seriously, that could have been me. I could have been Ella. Any one of you here could have been Ella. And that changed everything. I realized that our planet is just as sick as I was. And while the causes may seem to be invisible to our eyes, its effects are definitely palpable and unmistakable. Because of it, the health of millions of people around the globe is compromised, and it's taking away the lives of the people we love the most. In fact, nearly 1 out of every 4 deaths today is linked to unhealthy environments. Because when streets flood, children develop diarrheal diseases. When heat waves strike, elderly people collapse due to heat stroke. And when our food systems fail, we all go hungry. These are the very reasons why doctors and health professionals can no longer afford to stand on the sidelines. Because for us, to thrive means to be healthy. And to be healthy in the 21st century is no longer just personal, it is planetary. Planetary health is a new science that is built on one simple truth: healthy planet, healthy people. We can only thrive if our planet thrives. And no, this is not just about planting trees or hugging polar bears or even becoming environmental activists. Rather, it's about realizing that the health of our patients goes beyond the four corners of our clinics. It's about realizing that our health is shaped by the air we breathe, the water we drink, and the climate we all live in. As a family and community physician, I see this every day. Dengue now spreading beyond the tropics as the planet continues to warm, with 2024 officially recorded as the hottest year ever. heart and lung diseases worsening as 99% of today's population now breathing polluted air. Communities washed away, thousands of families left homeless as disasters and extreme weather events become the new normal. And here in the Philippines, these crises are magnified. We are the most disaster vulnerable nation in the world, stricken by stronger typhoons, heavier floods, and longer droughts each year. We are the center of marine biodiversity, and yet we're also the number one ocean plastic polluter in the globe. And just recently, Manila, our capital city, ranked as the most air polluted nation and city worldwide. These are wake up calls. Wake up calls that environmental degradation is not just an ecological issue, it is a public health emergency. And the sad reality is, it is the poorest who is always hit first, the hardest, and the longest. I share this message because it is time. Time for doctors and health professionals to expand the circle of care. Time for us to stay true and to uphold our oath of doing no harm. Time for us to rise up to the challenge of building a more sustainable, equitable, and healthier future. And we don't have to start with something big. In fact, we can start with something small yet powerful. Prescribe clean air and exercise by encouraging active transport. Educate our patients about the impacts of climate change on their health. Make sure that our clinics and hospitals are more sustainable by conserving energy and reducing waste. And most of all, using our collective voice as trusted leaders in society to advocate for change. And mind you, this task, it's not just for health professionals. For each and every one of you here, your everyday choices matter. Choose local plant based foods when available. They are healthier and they're lighter for the planet. Walk, ride a bike, take public transport when you can. They are better for your heart and the air we share. Support renewable energies, limit the use of single use plastics, and most importantly, raise your children to love and care for nature. Because lifelong stewardship starts in the family. And so, whether you are a health professional, a policymaker, a business leader, an educator, a student, or a parent, we all have a role to play. And the choices we make today will shape not only our health, but also the health of generations to come. I firmly believe that if we truly want to thrive, we must heal both people and planet together. Imagine a world where floods are already controlled, where our children can play safely under the sun, where we can all breathe clean air. No more stories such as Ella's or mine. If trillions of pesos can be wasted on ghost and faulty projects, imagine what trillion acts of care, responsibility, and courage can do in realizing a future where both people and planet can thrive side by side. And so, with love, urgency, and hope, we all now say to Mother Earth, the doctors, and all of us will see you now. Thank you.